Hello, everyone. Thank you for joining me again and on my channel. It's been a while, but I'm back. So you should start seeing more of these as time comes up. So we're going to go ahead and jump right in. Today, we're going to talk a little bit about diabetes and coding that diabetes with those presumed conditions. Even though we know that the WITH guideline has been out for years now, it still seems to be a challenge for coders. So, reporting diabetes in conjunction with those associated conditions, we know is definitely a challenge, and it can be a challenge. Fortunately, the ICD-10-CM provides us with the convention that helps direct the coding process. The with convention, when you go in and you look it up under the guidelines, you'll see that the with condition states that the word with or in should be interpreted to mean associated with or due to when it appears in a code title, the alphabetical index, or an or an instructional note in the tabular list. The classification presumes a causal relationship between the two conditions linked by these terms in the alphabetical index or tabular list. These conditions should be coded as relative related even in the absence of a provider's documentation explicitly linking them, unless the documentation clearly states that the conditions are unrelated or when other guidelines exist that specifically requires a documented linkage between the two conditions. So this really it spells it out. It tells you exactly what you should be doing. So based on the direction of the with condition, ICD-10-CM presumes the causal relationship between diabetes and multiple common conditions that are linked to diabetes by the subterm with in the alphabetical index. So if you go to your alphabetical index, you'll see that there is a long list of conditions where the causal relationship with diabetes is presumed in ICD-10. We're not going to talk about all of those today. I'm not going to give you that list, but definitely if you go in your ICD-10 book, you'll be able to find that. So if the documentation states that a condition routinely associated with diabetes is due to a different etiology, please, please, please do not also presume a causal relationship with diabetes and do not code as a diabetic complication. If coders are unsure about whether or not a specific condition is due to or with diabetes, you need to actually consult your alphabetical index for the subterm diabetic. And under that main term, you will find all of the associated conditions. So let's just talk a little bit about one example. So, an example of this is that you have a patient who's diagnosed with diabetes, and also they're diagnosed with amyotrophy. Amyotrophy. Under the main term diabetes, amyotrophy is listed under the with subterm. So whenever you see that, it's recommended that you should actually code the E1144, which is type 2 diabetes, with your diabetic amyotrophy. So that's just one example of when you're looking for it. Again, you're going under diabetic, you're going under your diabetes, you're looking for the with as a subterm. When you find that with, you're going to look for the other conditions, see if it falls under that. If it does, then that's when you want to actually code it. But keep in mind, as the guideline states, if the provider mentions in his or her documentation by any chance that the two are not related, then you do not presume that there is a relationship and do not code it. So that's just a little example. It's not a whole lot, but just something I wanted to touch on for us for today. And just remember that coders are encouraged to make sure that you consult the official coding guidelines and also make sure you go into your AHA coding clinics if you have access to it. If you do not, it's worth it. Well, trust me, it's worth it to have your AHA coding clinic. That way you can review the direction for applying the WIP convention to specific instances of diabetes with associated conditions. Well, thank you for joining me for today. Stay tuned and you'll see some more videos coming up soon. Take care and have a great day.